Hi, Harshita. Welcome to the podcast. Could you please tell us a little bit about yourself?
Hi, Misha. I hope you're having a great day. So, I'm a medical graduate from Bangalore Medical College and Research Institute, and I work in climate change, mental health, and SRHR.
What prompted you to pursue this path?
Medical or climate action?
Actually, both, but I'm more interested about the medical part right now.
Okay. So, I've wanted to be a doctor since the age of 4. I was inspired by a TV show called Incredible Medicine. And what happens is it's something really simple, okay? There's this one patient who keeps getting sick and sick. And towards the end, they completely lose all hope and they've like resigned themselves. They're formulating their will and getting things ready. And then finally, they get a diagnosis. And this diagnosis, it's usually one of the two types. It's either a rare disease or an uncommon presentation of a regular disease. And when they get the diagnosis, it's like the treatment, which was all supportive and, based on whatever symptoms they were exhibiting, it actually gets more tailor made and customized to that patient's illness. And that spark of joy, the hope for like, oh my God, I'm going to get better. There's a better tomorrow. There's hope for a future. I was like, there's no other profession that can give me that much of joy and happiness. So I was like, that's it. I want to be a doctor. And yeah, I'm just happy to say that now I can officially call myself doctor, but there's still quite the journey to go.
Yeah, but that's a really good story. It's good that you realized early on what you wanted to do. A lot of people are not that lucky and they take a long time to figure it out, but either way, it's good. So what happened regarding the climate aspect? How did your journey begin, and what are you the most interested in the climate space right now?
Well, as a doctor, it's obviously going to be health, like, I mean, since the age of 4, right? But actually, I think climate change found me rather than me searching for climate action. So, while I was like, going through my schooling years and everything, I was very fascinated with the work that WHO is doing. And I was somebody who always wanted to travel the world and see the world. And I wanted to do something about the communities over there. I didn't want to just do sightseeing and take pictures and all of that. And I was always of the opinion that to be in a space like the UN or any other space, you need to come with a lot of experience, with a lot of knowledge and education. So it wasn't something that I thought I could immediately do as a medical student but there was something that I read about, which was MSF, Médecins Sans Frontières, or Doctors Without Borders. And basically, they're the humanitarian agency and they help out in all of these spaces. And that's when I realized that I really like working in this kind of a field and I would like to do it because, I mean, I get to travel and I get to work and I get to experience the actual life of people that's happening over there. And while looking into like their job opportunities and stuff, I found that they work in like disaster settings. So I did a course in disaster medicine and I realized that a lot of these disasters are not natural. And I didn't know until then, this is kind of embarrassing to say that even at like the age of 21, I still thought that disasters are natural and it's all like these tectonic plates moving or weather events that's happening. And I realized that I don't want to just do first response, but I want to actually do something that can prevent this from happening in the first place. Because a disaster is a place where the entire surrounding and your system has actually collapsed. It's overwhelming the system. You don't have enough resources. And when I realized that climate change is one of the biggest drivers, I was like, okay, I will work on climate action. But also, I mean, like, there's a lot of issues with climate change that we see every day, whether it's the Delhi's air pollution that we're talking about, or right now, Bangalore's urban flooding, so on and so forth. I feel like it's very inherently linked to our everyday lives. I just didn't think that as a single person, I could do something about it. If that makes any sense.
Absolutely. I just had one follow-up question regarding this. As a lot of the youth is being aware of the climate changes and the challenges ahead, if they want to start their career in the same field and if they want to start by taking baby steps, what advice would you give to them to proceed ahead?
I think I want to frame this in this way. So if you've heard about the Sustainable Development Goals, the S stands for sustainable, and I think whatever action we're doing has to be sustainable in the long run. So if you want to start off with something, I'd say find something that you're super passionate about, and find something that you can continue doing and that you do in your everyday lives. Like for example, my mom, she's also a doctor, she's a pediatrician. So while I talk a lot about SRHR, mental health, air quality levels, my mom decided to do something super simple, which is basically composting. Because she absolutely loves cooking, so she decided that okay, what can I do to ensure that I'm buying locally sourced food and locally available vegetables. And also after that, she's like, I just really like these vegetables, they're super cute, and decided to open like a home garden. So now I have a garden on top, and my dad is just like, I'm not watering the plants. My mom's like, it's fine, it keeps raining, it'll sort itself out. But I think that's a contribution to climate action. She's sustainably sourcing food. She's reaching out to like farmers to get something that's organic, and then she's ensuring that whatever's made is like it's not in excess quantity, it's also nutritious. And also at the same time, whatever's left over, she's composting it. I think that's, if someone everyone takes a step, that's a change in their everyday lives, something that works for them, and then starts to expand it and motivate their friends and their peers, family, so on and so forth. I think that's a difference enough.
Absolutely. I 100% agree with you. But also, I have seen a common misconception go around that entering the climate space is very tough. Like, it is very concentrated at this point. I am of a different opinion, but I want to know what your thoughts are on it.
Well, I don't know about concentrated, but I think anything in life is difficult. I mean, being a doctor, being an engineer, being someone in the climate space, being a farmer, it's about, do you really want it and how badly do you want it? If you are someone that is driven, you're someone who really wants something, I'm sure no matter what is concentrated or if it's not, you will find your niche area where you can make an impact. Something that I've realized, I think, going back to like what my career path is, which is a doctor. So I was working in one of South India's biggest government hospitals, which is Victoria Hospital. And every day I was like, there's so many people outside that need healthcare services. There's so many people whom I should be helping, but I'm stuck here, I'm not doing enough. And somebody told me that, hey, at least right now you're saving this one person's life. So why don't you give them the best possible care? And maybe when you have a little bit of extra free time, you can do beyond that. So I feel like even if you're doing one action, if you're able to do it well enough, you're able to make a tangible difference. But to actually work in a space which is like climate action or anything, it's a collective effort, so it's about, can you inspire each other, can you find your people and do it together.
That's a very well put out thought over there. And even for our audience, that's what matters. If you take a small step ahead in the path that you want to pursue, it makes all the difference, right? So now, given your extensive involvement in climate-related health forums, what key initiatives or projects you are currently advocating on, and how do they integrate health resilience into climate action plans?
Wow, that's such a technical question.
But it's
Huh.
important for our audience to know as well.
Okay. Whenever I teach about climate and health, so I've taught young people, but I also had the opportunity very recently to teach people who were slightly elder to me. So this was like the 30 to 40. And I was like so confused. I was like, oh my God, am I the right person? But the way I explain it and the way I see it rather is there's a lot of avenues that it can affect your health. So let's start with the very basics. Health, but as defined by WHO, is not merely the absence of a disease, but also your physical, mental, social, emotional well being. And if it's your physical, social, mental, and emotional well being, there's a lot of ways it can be affected. So, if you're somebody who is interested in, let's say, nutrition, then you can talk about food systems, right? Whether this is about being vegan or not, it's about, okay, are you able to source locally sustainable, healthy food choices? Is what you're taking good enough for your body to actually handle? Because India is a country that has a lot of malnutrition, and we're also a country that's improving. Our child mortality rates, our maternal mortality rates, there's a lot of programs that is done by the government on midday meal schemes, which ensures that this child is getting adequate nutrition and is also at the same time able to have an access to education. So that's one program right there. You could be somebody who's trying to make nutrition that's accessible. Or antimicrobial resistance, which is again an upcoming issue in the health space, that also is defined by a lot of these antibiotics that we put into our meats, and also the overusage of it. So that's another place that you can work on it. Or even, like, let's say this, every Indian household knows what malaria and dengue is. I mean, as soon as the monsoon season starts, everyone's just like, cover your hands, cover your ears, cover your face. I know my grandmom used to put monkey caps on me, and I absolutely hated it. She's like, no, what if it bites your cheek? And I'm just like, it's this little bit of blood. It's not going to make a difference. But even knowing then is that these diseases are actually endemic to the tropical regions, which is where India is. But now, because of global warming, these so called tropical regions are expanding, which means these tropical diseases are no longer endemic to just our countries and will expand beyond that. Or when we talk about mental health, like, let me put it in this context. Have you ever found it very hard to concentrate when there's a lot of heat? Right? I mean, that itself is like an issue. So now imagine if somebody actually has like a mental health disease, like anxiety or something, if that could be exacerbated, or just not knowing, okay, am I going to get food for tomorrow? Is a disaster going to hit my community? Having climate anxiety over there, that's another thing. Or gender based violence, right? Like these SRHR space, like access to contraception. If a disaster hits, mothers and children and the maternal care services that's there, this so much that you can talk about, and there's so much to do. And I think it's about like finding your area. What is it that you're passionate about? And I know I keep coming back to this, but I think that's important because while there's a lot to do, doing one thing and doing it properly actually makes a difference. But maybe in the beginning of your time, you can try out all of these things, feel out the space, see what your niche area is, what really resonates with you, calls out to you, so on and so forth. What I advocate for at um, national and international platforms. Let's see. I've spoken about climate financing, partly because last year was the first time that health was actually recognized officially at COP. We had the first health day and everything. And we also had like finance that was promised for climate and health. And we also had the loss and damage fund. But right now, like less than 2% of financing is actually climate and health financing. And there's a lot of health co-benefits that come with climate action, with mitigation, so on and so forth. Like if you reduce your air pollution levels, that means a lot more people can go out into the streets. That means they can work, so on and so forth. So that's an adaptation measure right there. But mitigating for it literally means that it's improving the lives of so many more people. You probably might not have um, diseases like asthma, you know? So that was one thing that we were speaking about, was like, can we ensure that more climate financing is available, which is readily available, and more grant based rather than loan based? And also, can we ensure that it reaches like the grassroots levels? Because while countries and institutions do need this, a lot of work is done at grassroots level, commit communities and organizations. um, I also talk a lot about the SRHR and climate space, which is basically about how does climate change impact SRHR? A lot of times when we look at climate, we see women as beneficiaries, and we see them as a vulnerable population group. And this is without understanding that they themselves are actually protectors and guardians also of climate action, and they have so much of capability. But just for context, there's a lot of early child marriages that happen, mainly because people are like, okay, at least my child is now with a better family, she's probably more safeguarded. And in countries like the Africa, there's an increased rates of female genital mutilation. There's also the fact that, women have to, because, okay, let me put it this way. When you're hungry or you're thirsty or you need anything, who's the first person you ask for help? Your mother, right? Like very inherently, everyone just ends up being like, Amma, where is this? So it's literally that the household is being taken care of by women. So if you don't have access to food, you don't have access to water, it's these women who actually go out and ensure that you're able to get it. And when you walk longer miles, it means you have increased chances and risk of gender-based violence. And there also have been cases that are reported where you've had transactional sex just to ensure that you're able to have these. So these are things that we also talk about. um I think I've covered all of it, but if you have any specific questions, I'm happy to answer that.
Yeah, actually, I was just reading a report this morning that said that more than 50% of women in India are anemic. But that's a problem that is often brushed under the rug. And there are many, as you also said, that there are so many things to talk about, but we do not have the right education or information regarding it to go ahead. So, in respect to that, how can we make it more accessible to general population so that they are aware and they know how to proceed regarding that?
So I'm not sure about if 50% of women are anemic, but I should mention that almost every woman, at least when she's pregnant and stuff, is supplied with folic acid and iron tablets. Um, Coming back to education, something that's been advocated a lot for by young people in the healthcare space is for the integration of climate education into the medical space. There is, for context, in India currently, in our community medicine textbooks, where we do talk about, okay, this is what climate change is, this is disasters, this is how it affects healthcare systems, so on and so forth. But an in-depth, talk about it, maybe for like 10, 12 hours, like how we usually cover a chapter, that's not there. And this has actually been changing, and a lot of like senior professionals in the space as well have been doing a lot of climate and health education, I would say. But when it comes to a country like India, we are a very diverse country and I'm not talking about diversity just in our regions, but also in our languages. And trying to explain to someone about why they should care about climate is kind of difficult when they don't have even like a shelter above their head, or they don't have like food to eat, so on and so forth. The way that I've actually seen it and done it, at least in the past, was when you tell someone that their health is being affected, and you say that, okay, you're not going to be able to do all these things you're doing right now, or take care of your family, so on and so forth. And if you're in the best of your health and you have all of these opportunities that can you can utilize, people are more likely to take action. So that's a way that I've usually spoken to patients who've had issues because of climate change. But a lot of climate change issues, they also take time to, present in people sometimes. Like, a lot of us have heard that smoking causes lung cancer, but this is something that we've been hearing for the past maybe 10 years. Did you hear about it before that? So now just imagine when you have something that's climate related. There are a lot of factors that can cause diseases. Most of the diseases that we study, we literally have like a subject called microbiology. So we say that, okay, this can be attributed very directly to this one particular microorganism. But with climate, it's so much more complicated because it depends on your socioeconomic status, it depends on your exposure, what you've been exposed to, how long, so on and so forth. That's another challenge, and a lot of research is being conducted on it right now. And I mean, it's absolutely great to see what's happening. But in the context of India, I think the best way to actually ensure that it reaches the masses is to be able to speak to them in their own regional languages with the context that's happening to them in their everyday lives. So while last year, when the Yamuna floods actually hit Delhi, there was a lot of first response, and the government had a lot of initiatives, so on and so forth. So we didn't come in at that point of time. We came in almost about 2 months later, I guess, and we held a health camp on the 15th of August. And what we did was we not only ensured their access to basic medicines like diabetes and hypertension, but we also did teach them about, okay, how can you protect your health and well being in the context of climate change? This was so relevant at that point of time because they're building back. And while you're building back, you have a chance to actually make the maximum difference because you can build back better, a healthier, and a more resilient society. So I wasn't the best at speaking in Hindi, so I had like my friends who helped me out, and I was just like overviewing and stuff like that. But I think that the biggest difference that we were able to make at that point was because I was also had the support of Yango, which is the official children youth constituency to the UNFCCC. Whatever findings we had on ground, like how many people did we treat, what medicines were we using, what were their responses, we were able to push for it into like a policy demand and actually share it and have it inputted into the global youth statement. And this was also showcased at COP28. I think like that's something that was like really resonated with me.
This is really important and useful information for all our audience upon how they can reach out to more people and help spread the word regarding climate. I have a follow-up question regarding this. That you mentioned that when you were working at the Victoria Hospital, you felt stuck and you felt that you did not impact many lives. So, from there to the point where you are today in your life, how can one scale up, like uh, to a global level or to reach more diverse audiences? What are the challenges that you faced? How did you navigate them?
I will say that working in a government hospital has been one of the biggest rewards that I could have ever had because I met people from so many different walks of life, like from the poorest of poor, even to like some rich people. Because, you know, where I live in Bangalore and Bangalore's like the capital for Karnataka and everything. I had the right mentors and I looked up to the right people and they were able to like share these spaces and opportunities with me. So as a youth, maybe something that I could tell other youth is that meaningful youth engagement and participation and representation is so important. And I cannot stress this enough. And when I say meaningful, I mean they are change makers, advocates, and experts in their own rights. And that has to be capitalized on. It's in their own niche. You know, you don't have to, if you probably gave me something to speak on agriculture, I'd say, no way, this is not for me. And I would recommend you to a friend of mine. But to another youth, if you're okay in a space where you have the privilege of being invited to conferences, if you're able to actually ensure access to another youth, whether it's by giving badges, mentioning their name, ensuring that they're able to contribute beforehand by, you know, sharing documents and stuff with that, there are so many ways, or even capacity building, you know, because a lot of them feel like we don't have enough it we don't have enough knowledge about this space, so feeling like they're empowered to actually be able to speak, I think that's so important. So if it's like one youth to another youth, and this is what I would say, like find the right mentors for you and ensure that you're meaningfully engaging with them. And if you're somebody who could be a mentor and could open up these avenues, then please do, because more voices is always better.
That's amazing. That's a really powerful message for all the youth that is watching this podcast today. And following up on that, I would also like you, lastly, to ask uh, what message would you like to give to our world leaders? How can they ensure that more youth is empowered and they have a space to speak?
In the past couple of years, since I'm quite new to the space myself, like I've been working for about 3 years, I've seen a lot of progress in meaningful youth engagement and representation. And even with like the establishment of the UN Youth Office, and now that there's a Summit of the Future, which had the Pact of the Future that has just been adopted, I think there's like so much hope. I guess what I would say to the world leaders is to include all youth in all their diversity at all levels of decision making. Like from the ideation, like the conception, all the way to the implementation. I think we should be involved at every single step, mainly because at least a lot of these spaces a lot of these spaces require intergenerational collaboration. You know, we come with the enthusiasm, with the drive, with a lot of passion for the subjects, and they come with a lot of experience from working on ground, and both can be capitalized to create something that's so beautiful and to safeguard what's already left. And we are youth today, we're going to be adults tomorrow, where we're going to be deciding. And there are already so many youth as delegates who are deciding on our behalves. I mean, whether it's in parliaments, it's at, UN spaces, so on and so forth. So I think that to the world leaders, I would say, capitalize on our potential and help it grow.
Thanks a lot, Harshita. That is really a lot of insights packed in one podcast. And it was really great speaking with you.